Patients are not just from our area. Patients from across Texas are making their way to the South Plains for coronavirus treatment. KLBK's Alyssa Tejas spoke to staff with Covenant. Alyssa, these patients are coming from all over Texas.
Terry, Covenant Health has accepted patients from East and Southeast Texas because hospitals in those areas are reaching capacity. Flying hundreds of miles for treatment.
Clearly, a lot of patients are being sent to us because of our ICU capability.
And coming as far as Houston, San Antonio, and the Rio Grande Valley to Covenant Hospital.
Those are areas that typically do not send patients to the Lubbock area.
Chief Medical Officer Dr. Craig Ryan says hospitals in those areas are overwhelmed. They have far too many COVID-19 patients needing ICU beds and even non-ICU beds.
And they're asking us to help them out, and we're happy to do so.
According to the Texas Department of State Health Services, Lubbock currently has 322 available hospital beds, 17 available ICU beds, and 144 available ventilators.
It really is a function of opening human activities back up to the point that there's just more exposure out there.
Dr. Ryan says the severity in patients from other parts of the state are similar to what we're seeing on the South Plains. Still, he says it didn't come as a surprise Lubbock hospitals would have to start taking patients from across Texas. And the number changes constantly.
58%, last time we did the numbers, 58% of our patients in the ICU were outside of Lubbock County.
And Dr. Ryan says they will continue to take patients from other areas as long as they have the capacity.
So we're doing for our healthcare compatriots exactly what we know they would do for us in the same circumstances.
And Dr. Ryan tells me there are some challenges that come with accepting patients from other areas. Many aren't getting family support because they're so far away. Patients are also flown here, so it can be hard to figure out the logistics of getting those patients back home. Terry?
Very true. Thanks so much, Alyssa. A Texas Tech lab is not slow